Okay, dear students, welcome to the channel once again. So in last class, I have been discussing about tetralogy of Palo. Okay, I have discussed till clinical manifestations. So now we will continue with the diagnostic evaluation and management of tetralogy of Palo. Okay, so let's continue with the diagnostic evaluation. Okay, so how we are going to diagnose this tetralogy of Palo? First one is history collection. We can collect history from mother that whether she used to have alcohol or do smoking during the pregnancy. We can also have collect the history regarding from mother that whether she is suffering from any maternal insulin dependent diabetes mellitus, whether she used to have any drugs during the first trimester of pregnancy, okay, whether there is any infection during the first trimester of pregnancy, okay. So all those information, okay, whether there is any prolonged labor, delayed labor, whether baby is unable to establish proper breathing after the birth. So all those information should be collected from the mother. Next one is physical examination. So when you do physical examination of a baby with a tetralogy of Palo, you can see there is a cyanosis will be there, bruised discoloration of skin, nail, okay, lip, tongue, you can notice, and there will be dilatation of fingers, we can see because of hypoxia, okay. And when you do a physical examination, you can see there will be tachycardia, tachypnea, okay, shortness of breath, all those things you can see, okay. So all those findings we can see in the case of a physical examination. And when you do chest X-ray, we can see there is a right sided heart enlargement, we can see. And when you do 2D echo, we can see there is a abnormal shunting of blood from right ventricle to the left ventricle, you can see. And pulmonary stenosis, how extent of pulmonary stenosis is been happened, that also you can notify that that is given by the 2D echo, okay, that evidence is given by the 2D echo. And cardiac catheterization, we can do like a right sided heart catheterization. So when you do right sided heart catheterization, so what happens here, the catheter is inserted, okay, the catheter is inserted into the pulmonary vein, sorry, not a femoral vein. Femoral vein we will insert the catheter, then the catheter is advanced, okay, the catheter is advanced from femoral vein to the inferior vena cava, okay, up to this inferior vena cava the catheter is, okay, inserted, catheter inserted into the inferior vena cava, then into the right atrium, okay, catheter inserted into the right atrium, then into the right ventricle, okay. So as soon as the catheter inserted into the right atrium, we can come to know about the chamber pressure. So chamber pressure will be obviously high. It is because of a high, because of there is a, what is that, high pressure in the right ventricle and right atrium. And as the catheter is advanced, okay, into the right ventricle also having a high pressure. There is a more pressure, okay. So apart from this, when you insert the catheter into the pulmonary artery, there is a pulmonic pressure, pulmonary hypertension will not be there because there is a decreased pulmonary blood flow. There is no pulmonary hypertension, okay. And what we do, as the catheter, okay, once the catheter enters the right ventricle, if you inject the radiopaque dye, you can see there is a shunting of blood, okay, there is a shunting of blood, okay, there is a shunting of blood from right ventricle to the left ventricle. So as soon as the catheter, the tip of the catheter enter into the right ventricle, okay, we can inject the dye, okay, we can inject the dye. So after injection of the dye, what happens here, there is a shunting of blood from right ventricle into the left ventricle, that you can evidence in the fluoroscopy by taking post injection of dye images we have to take, okay. So this is all about the diagnostic evaluation of a tetralogy of Palo. So the management of tetralogy of Palo consists of, first one is medical management, okay. In medical management, first one is oxygen therapy, okay. As this is a cyanotic heart disorder, there is a lack of oxygen supply to the tissues, so we need to give supplemental oxygen. That is very important here in the management of cyanotic heart disease, okay. And next one is correction of anemia, like other congenital heart disorders how we have discussed. So this tetralogy of Palo also very important. In this condition also it is very important to correct the anemia. If baby is suffering from anemia, child is suffering from anemia, if you do not correct the anemia, that will lead to development of a congestive cardiac failure. So correction of anemia, how we can do it? By iron supplementation or iron rich nutritious diet that includes jaggery, groundnut, okay, beetroot, okay. We can also have a green leaf vegetables we can suggest to the child. And next, if necessary, we can also do blood transfusion. And next one is injection prostaglandin, okay. Injection prostaglandin, why we give injection prostaglandin? So if we give injection prostaglandin, it will not allow the ductus arteriosus to close. Okay, so it will not allow the ductus arteriosus to close. So that is an advantage. Okay, how there is advantage of, okay, what happens here? So this is the pulmonary artery, and here we have a aorta. Okay, here we have aorta. Okay, and here this is a, there is a opening here. Okay, there is a opening in this. Okay, so here you can see there is a opening. So this is known as ductus arteriosus. Okay, this is known as ductus arteriosus. So this ductus arteriosus will close 2 to 3 days after the birth. Okay, so when you administer this injection prostaglandin, it will not allow the ductus arteriosus to close. It will keep ductus arteriosus open. Okay, so like just like a condition of patent ductus arteriosus, it will be, opening will be still present. So this will this opening will show what happens here. There will be shunting of blood from aorta to the pulmonary artery. There is a shunting of blood from aorta to the pulmonary artery because the pressure in the aorta is more than the pulmonary artery. And by this surgery, by this injection, what happens here? There is an improvement in the pulmonary blood flow and increased oxygenated blood come to the right atrium, increased oxygenated blood come to the right atrium and right ventricle, and good oxygen saturated blood go for the peripheral tissue perfusion. So that will lead to reduction in the cyanosis of the baby. So that is why we administer the injection prostaglandin. Now let us see what is the surgical management of this. So surgical management, first one is palliative surgery. Palliative surgeries are mainly done to reduce the cyanosis. Okay, palliative surgeries are the one which are used to reduce the symptoms. Okay, so here the main symptom of tetralogy palliative is cyanosis. That is nothing but a lack of oxygen supply to the tissues. So the palliative surgery, what we do here, 3 types of palliative surgery we will do: modified Blalock Towsing stents, POT stents, Waterstone stents. Okay, so let's discuss one by one. Okay, so this is the heart. This is the aorta. And here there is a subclavian artery. Here there is a subclavian artery. Okay. And this is a pulmonary artery. Okay, this is a pulmonary artery. Okay. So what you do in modified Blalock Towsing shunt, in this condition, what you do here, we will just make a opening. Okay, the surgeon will make an opening between the subclavian artery. Okay, the opening is created between the subclavian artery and opening is created from subclavian artery and right pulmonary artery. Okay, so this is the right pulmonary artery. This is a right pulmonary artery, and this is a subclavian artery. Okay, this is a subclavian artery. So this right pulmonary artery and subclavian artery, anastomosis is made between the right pulmonary artery and subclavian artery. Okay, so because of this, what happens here, there is a shunting of blood. There is shunting of blood from subclavian artery to the right pulmonary artery. So because of this, what happens, there is increased pulmonary blood. The blood flow for the oxygenation, the blood flow to the lung for oxygenation will increase. So because of this, what happens here, more and more oxygenated blood come to the right, more and more oxygenated blood come to the left atrium, and more oxygenated blood come to the left ventricle. And on contraction of left ventricle, more and more oxygenated blood go to the, okay, peripheral tissue perfusion. Okay, the amount of oxygen saturation after this surgery will be more. There is a good amount of oxygen saturation. So good oxygen saturated blood come to the left side of the heart, and good oxygen saturated blood go for the peripheral tissue perfusion, and thus it reduces the cyanosis. Okay, as by improving the oxygenation of tissues. Okay, so this is modified Blalock Towsing shunt. Modified Blalock Towsing shunt, where the cardiothoracic surgeon create an anastomosis. He makes an anastomosis between the subclavian artery and right pulmonary artery. Thereby there is a shunting of blood from subclavian artery to the pulmonary artery, increase pulmonary blood flow, increase oxygenation of blood, and increase oxygenated blood. Okay, a good volume of oxygenated blood come to the left atrium and left ventricle, and then good volume of oxygenated blood go to the peripheral tissue perfusion. Okay, next one is port shunt. Okay, in the port shunting, what do you do here? Okay, so here in port shunting, what do you do here? Uh, Here the cardiothoracic surgeon creates an opening between the descending. This is a descending aorta. Okay, this is a descending aorta. Descending aorta. Okay, aorta, and this is a left pulmonary artery. Okay, this is a pulmonary left pulmonary artery. Okay, left pulmonary artery. So here in this port shunting, what the surgeon will do here? He will make artificially create an anastomosis between the descending aorta and left pulmonary artery. So because of this, what happens here? There is a shunting of blood from descending aorta to the pulmonary artery, and that will lead to increased pulmonary blood flow. So when there is increased pulmonary blood flow, there is an increased oxygenation of blood, and increased volume of oxygenated blood come to the left atrium, then to the left ventricle. On contraction of left ventricle, there is increased volume of oxygenated blood, oxygen saturated blood go to the peripheral tissue perfusion. Thus, it reduces the cyanosis. It improves the oxygenation of peripheral tissues. Okay, so this is a port shunting. Next one is water stone shunting. Okay, in case of water stone shunt, what happens here? The anastomosis is created between the ascending aorta and right pulmonary artery. Okay, ascending aorta and right pulmonary artery. Where we can do here? See here. This is the ascending aorta. So here the anastomosis is made from ascending aorta, and this is the right pulmonary artery. Okay, so an anastomosis is created from ascending. This is the ascending aorta. Okay, so this is the ascending aorta. Okay, and this is the right pulmonary artery. So here an opening is created from ascending aorta and right pulmonary artery. Okay, that is done in the water stone shunting. So because of this anastomosis, what happens here? The blood from high pressure in the ascending aorta will move from aorta to the pulmonary artery, and thereby there is an increase of blood supply, to the lung. Okay, there is increased pulmonary blood flow and increased oxygenation of blood. So good saturated oxygenation. Okay, oxygenated blood come to the left atrium and then to the left ventricle, and good volume of oxygen saturated blood go for the peripheral tissue perfusion. Thereby it carried the cyanosis by improving the oxygenation of peripheral tissues. Okay, so these are the surgeries that are done, okay, to treat the cyanosis, to reduce the cyanosis in a child. Okay, now let us discuss about the definitive surgery, that is open heart surgery. Okay, what is definitive surgery? Is open heart surgery. So in open heart surgery, what they will do here? Okay, in case of open heart surgery, so in case of open heart surgery, first the child will be induced with the general anesthesia, after that sternotomy, and then opening of sternum, then child will be placed on heart lung machine. So after that, what they will do here? So here there is a pulmonary artery, no? So this is a pulmonary artery and there is a pulmonary stenosis. Okay, this stenosis. So this stenosis is reduced by replacing. If the stenosis is very severe, okay, and there is a severe obstruction in the flow of blood, then they can do complete wall replacement. The wall can be completely removed, or they can also make some balloon. Balloon can be inserted into that can be inflated or deflated. That will reduce the stenosis. Okay, and how they are going to correct this ventricular septal defect? By directly placing the dacron patch over this one. Okay, so in open heart surgery, mainly they will correct the pulmonary stenosis and ventricular septal defect. So when the ventricular septal defect, when this defect is closed and pulmonary stenosis, that is wall defect is corrected, then there is no cyanosis. Okay, there will be no shunting of blood from right ventricle to the left ventricle, and there is no obstruction in the flow of blood from right ventricle to the pulmonary artery, and thereby there is an improvement in the condition of the health of the baby. Okay, so this is a open heart surgery. Now let us discuss about the nursing management. So the last part in this one is nursing management. So nursing management here, it comprises mainly, first we need to give oxygen therapy. Okay, so the child should be supplied with oxygen because there is a cyanosis is a very big issue here. That is the main problem that we need to take care. And next one is fluid and electrolyte correction. Fluid and electrolyte balance. Okay, fluid and electrolyte balance and correction of dehydration. Correction of dehydration we have to do. Then next one is we have to take care of this perioperative nursing. Perioperative nursing care. Okay, perioperative nursing care mainly because the management of tetralogy peli is mainly concerned with the surgeries that may be palliative surgery or definitive surgery. So we need to prepare the child for surgery. Okay, preoperative preparation, intraoperative preparation, and postoperative preparation, and care of the baby after surgery is all that is very important here. Okay, and next one is we have to assign the child. Okay, assign child activity according to its tolerance. Okay, so child usually uses squatting positions. Whenever it does not tolerate the activity, it will have a squatting positions. Okay, so to correct the hypoxia, okay, we need to give a knee chest position to the child. Okay, we need to give knee chest position to the child whenever the patient is having a activity intolerance. Okay, so we need to assign the child activity according to tolerance. Assign child activity according to its tolerance. Okay, then apart from this, we need to correct the anemia. Okay, correction of anemia. So how we are going to correct the anemia? That is by giving a iron rich supplementations or iron rich nutritious diet we need to advise. That is jaggery, beetroot, green leafy vegetables, groundnut, and all those things we need to advise. And if the baby the hemoglobin is very low, then we can go for the blood transfusion. Correction of anemia is very important to prevent the development of congestive cardiac failure. Okay, and apart from that, the parents will be very much anxious and they may have a stress. So we need to clear the doubt. Okay, clear doubts expressed by parents. Okay, and we need to give emotional supports. We need to give to the parents. Okay, emotional supports we need to give to parents so that they will have some emotional relief. Okay, and we need to do follow-up care. This is very important here. Continuous we do follow-up care. We have to take care of the child till the child is completely become all right. Follow-up care is very important. Okay, so this is all about the nursing intervention that we need to carry. Okay, so this is all about the total in detail discussion about tetralogy of Fallot. Okay, if you have any doubt in this one, you can express in the comment box. And if you like this video, please press like button and share to other your friends. If you are first time visitors to my channel, please subscribe to the channel. So thank you very much.